Still ahead for President Obama getting his health care plan passed. And for more on that, let's turn to Dr. Howard Dean, the former chairman of the Democratic National Committee, as well as a former family practice physician in Vermont. Governor Dean, thanks for your time tonight.
Thanks for having me on, David.
Sure. Any critic of the White House who might try to claim that we should not attempt widespread health care reform at a time of great financial crisis, the health care system and the economy, they're linked, are they not?
Yeah, they are, and I think the president's doing exactly the right thing. He's doing the short-term things that have to be fixed, the stimulus package, hopefully a plan to remove the toxic assets from the balance sheets of the banks. The next thing is health care. If you want General Motors and Chrysler ever to be healthy again, you got to fix the health care system. You want small businesses to start creating jobs again, you got to fix the health care crisis. And then the long-term piece is education. You know, we've come a long way in education the last 5 or 10 years. We've got a long way to go, particularly with early childhood, 0 to 3, before kids even get to school. And that's what he's tackling today. And this is really one issue, not 3 issues. This is one issue. You want to fix the economy. You have a short-term problem. You got a medium-term problem and a long-term problem.
In the same way that voters want jobs and polls show they are overwhelmingly in favor of the stimulus plan, are most Americans going to be in favor of fixing health care? I mean, is there anyone other than the insurance company lobbyists and their Republican supporters who are going to be against this Obama plan?
Actually, David, that is about the only people that are against it. But, of course, they have lots and lots of money, and they're calling it socialized medicine. That, unfortunately, doesn't work anymore. You know, Medicare was put in 40-some-odd years ago, 44 years ago. Every Republican voted against it in the Senate. They called it socialized medicine. Now it's one of the most popular programs. And what we're suggesting that we do is, if you like what you have, you can keep it. If you like your own insurance and your employer-based health care, you can keep it. If you want to get into the new plan, you can choose between a private insurance company and a public entity, which would probably be Medicare. That's what the American people want. 73% believe they ought to have the choice, not the insurance companies and not the Republicans, about how they get insurance. And I think that's in the Obama plan, and that's the right way to go.
You mentioned socialized medicine. Should we expect to hear the word socialism come up again and again during this debate?
We will, but this party is so out of touch. The Republicans are struggling. They're using rhetoric from Joe McCarthy's era, and it's just ridiculous. The idea that Medicare is socialism borders on nuttiness. You know, it's just unbelievable what's going on in the Republican Party, and they're going to have to find their feet. There's a big debate among them about what they're going to do, and I don't think screaming and yelling about socialism if that's what you call Medicare makes any sense whatsoever. That the American people are so far beyond that, and they want real change. And I think so far the president's delivering real change.
He's also putting together his health care plan much more sort of in the open, whereas back in the early days of the Clinton administration, they met in secret. Then they introduced a plan to Congress and essentially had an up or down vote, and of course it got killed. How much of a difference is this sort of new process going to make this time around?
Well, I think the Congress is the key. The Congress will receive the bill, and they'll change it, and they'll rewrite it, frankly. And there's where you're going to see the battle. You're going to see whether the political people, the Democrats in Congress, which we have a large majority in both houses, whether they're going to cave in or not to the insurance companies and the Republican filibuster. My attitude is, if the Republicans filibuster this bill, let them filibuster it. Don't give up the important choices for the American people. Don't take away choice from the American people because you're afraid of the insurance companies and the Republicans. Let them filibuster and see what happens to the Republican Party in 2010. That will determine the future of the Republican Party.
Are you nervous that Democrats, at least in the Senate, are going to be perhaps a couple votes short and may essentially have to decide, okay, if the Republicans really want us to get to 60, let's test that filibuster?
I don't think they will be short. I think the American people understand that the Senate really understands the American people want change. 3/4 of the American people support the critical choice provisions in the Obama bill. And I think there are Republicans that are sensible, thoughtful people, and some of them don't just want to be the party of no, just as Susan Collins, Olympia Snowe, and Arlen Specter were. These are thoughtful people, and I think we can come to a reasonable and thoughtful bill which does include maximum choice for the American consumer.